What's the difference between cosmetic dermal rolling and medical microneedling? Hi, my name is Denise Dubois, founder of Complexions Spa for Beauty and Wellness and Dubois Skincare. Today I'm going to explain the difference between medical microneedling and dermal rolling. The main difference is really in the depth of the needle. This is a medical device and the depth of the needle is between 0.5 millimeters and 3 millimeters. So it's a much deeper procedure. This is a dermal roller. A dermal roller is a needle. There's 540 needles on here, and it has a depth of 0.25 millimeters and 3 millimeters. This is something that can be done on a daily basis, whereas your medical microneedling is a procedure that you would have done once a month for a maximum of 5 treatments, and they are spaced 1 month apart. So the way that you do your dermal rolling, we do recommend it that it's used in conjunction with an at-home care program. I start by dividing the face into 4 sections. You'll hold your dermal roller like a pen, and you're going to move up and down, moving across. You don't want to use the roller in one space going too many times because you can get what they call tracking. So you go up and down, and then you're going to change your position and go back and forth. And then on the diagonal. And you will notice that your skin will start to get a little bit pink. The purpose of the dermal rolling is to create micro channels in the skin that will aid the penetration of your products. You'll actually get an 80% absorption compared to a 10% absorption without using the dermal roller prior to applying your active serums. So you continue on to the next section, going up and down. Back and forth. You can go right over the eyebrow. Don't be afraid to do so. In fact, in the eyebrow area, it can help stimulate that growth. Around the eye area, you can go right up to the orbital bone, which is that orbital ridge. So going up and down right around the eye area, back and forth, and then diagonally. Continue on to the lower section of the face. When you do your dermal rolling, we do recommend that you do it in the evening because you can get some redness. As you can see, my skin is getting a little bit pinker. And you would start with a clean face. After cleansing and toning, you would then go right into your dermal rolling. The procedure typically takes between 3 and 5 minutes. You can also do your neck, your décolleté, and the backs of your hands. As we age, unfortunately, our skin does get a little bit thinner. So cosmetic dermal rolling does help to thicken the epidermis. Because as we do get older, we do get more hollow, especially in areas around the eyes. You'll notice that. So this does help to restore some volume in the skin. The upper lip. The first time you do your dermal roller, you are going to feel a little bit sensitive, but the more you do it, you'll get more used to it, and it doesn't actually hurt as much. I think it's a psychological thing. This particular needle is a 0.3 millimeter, so this is actually the deepest length that you would use for home use. And remember, it isn't necessary to go aggressive because you don't want to cause inflammation in the skin. That is actually an underlying factor in many different skin conditions and disorders of the skin. It actually can even accelerate the aging process. So you really want to avoid inflammation in the skin and doing too aggressive of a treatment. There are different types of collagen that forms in the skin, and treatments that are very aggressive and cause a lot of inflammation can actually stimulate the type of collagen that is very fibrous and not as natural looking. At the end of your cosmetic dermal rolling procedure, you would then follow it up with the appropriate serum. It's important that you are using clean formulas because anything that has ingredients like even essential oils or preservatives, fragrances, things that would normally not be irritating to your skin can actually be irritating because of the drastic difference in the amount of absorption that you're getting out of your products. We do recommend that you use something that's going to help to stimulate cell renewal and collagen production. So using copper peptides, some vitamins, nutrients. And another reason for using the dermal roller in the evening is because that is when your skin goes into a repair and rejuvenate phase. Your body is ready to absorb these nutrients and active ingredients, and you're also do not have any stressful external influences that are preventing the major benefits of the rejuvenation. So dermal rolling should be done in the evening. As I said, you may get some redness, but you're also going to be getting the most benefit by doing your repair and rejuvenate procedures in the evening. At the end of your dermal rolling procedure, you're going to cleanse your roller using hot soapy water, and then it is recommended that you actually fill a glass with water. Put your roller in here with a cotton pad on the bottom to protect the needles, and then to use a denture tablet. The denture tablet is much gentler and it won't dissolve the glue that holds the needles in place. You could also use rubbing alcohol or hydrogen peroxide, but again, you do run the risk of loosening the glue that holds your needles in place. With the dermal rollers, there are 540 needles, and you do want to look for something that's made out of titanium because it does tend to keep its sharpness for a longer period of time. So that's your dermal rolling procedure. Moving on to the medical microneedling procedure, we can turn the dial and it can go up to 3 millimeters, which is very deep. And the only time that you would ever go to that length would be in a medical setting. You're going to be going farther into the dermis of the skin, and it does create substantial bleeding. So you would not really want to do this something that deep at home. It's also very uncomfortable. We do use a BLT topical numbing agent of lidocaine, benzocaine, and topicaine. This is left on the skin for approximately 30 minutes before the procedure is done. Most people in the spa setting, the medical spa setting, are having it done for facial rejuvenation or for acne scarring. You can break up scars like hypertrophic scars or keloid scarring. You can actually break up that fibrous scar tissue with these procedures. And this device is, at this time, the only microneedling device that is FDA approved. So when we turn it on, you can hear it. The needles go up and down. There are 14 needles on the tip of this device, and we use a glide like a ultrasound gel on the skin prior to the procedure that helps the needle to glide across the skin. You'll have a mild sunburn sensation. You do get some pinpoint bleeding that typically subsides within a couple of minutes. The nice thing about this treatment, because remember, aggressive is not going to give you a better result. You can do the procedure, and we don't want you to leave here with bloody skin and inflamed and really irritated. We want to stimulate and create micro injuries that are going to stimulate the cell-to-cell communication. It helps to normalize functions of the cell. We can get improvement with oil production, with pigmentation, and then most importantly, the regeneration of the fibroblast cells, stimulating the collagen. But you're getting the right kind of collagen, not the fibrous kind of collagen. So the results with microneedling are actually more natural than doing some of the more aggressive laser procedures that are out there. The beauty of this procedure is also the channels do close up within 4 hours. And the next day, after having a medical microneedling procedure, you're safe to wear mineral makeup, and you can really go back to work and about your day without anyone knowing that you had a medical procedure done. You may have a little bit of residual redness, but that's easily camouflaged with the mineral makeup. So annually, you could have your medical microneedling procedures done for rejuvenation or to improve the acne scarring, or most definitely to use your dermal rollers with any good skincare program is going to enhance the penetration and also improve the overall texture of your skin. If you have any questions about medical microneedling or cosmetic dermal rolling, call the spa and we would be happy to arrange a personalized consultation just for you.